Ready to make a difference? This is the Palm Harbor Chamber of Commerce podcast, where we connect you with the stories behind our local businesses.
Welcome to the Palm Harbor Chamber podcast. I'm your host, Kert Rhodes, and today I'm in the ER. Again, not that way. We're actually here at AdventHealth Palm Harbor Emergency Room, just north of Nebraska on US 19. And we got some folks here that are part of the AdventHealth. I would like to introduce you guys.
Absolutely. My name is Andrew Santos. I have the privilege of serving as President CEO of AdventHealth North Pinellas, which extends to this ER right here in Palm Harbor.
Okay, awesome.
My name is Dr. Jose Barquin. I'm the AdventHealth Emergency Department Director for both the North Pinellas ER and the Palm Harbor ER.
Awesome.
And I'm Dr. Michael Longley. I'm the Chief Medical Officer here at AdventHealth North Pinellas, and also have the privilege of working in this emergency department as well.
Last but not least,
Matt Mennenna. I'm the CEO of the Palm Harbor Chamber of Commerce.
awesome to be here.
Great to have us.
Thanks for having
Different
us.
environment from the
Yes,
chamber, right?
a little different.
Just slightly different.
A little different.
But tell us a little bit more about AdventHealth.
Yeah, absolutely. So AdventHealth has been around since about 160 years now, and our roots extend from our Battle Creek, Michigan. And the premise was to build on whole person care, and that's mind, body, and spirit. And so we've extended now. We have over about 57 hospitals now across the nation, from as west as Colorado to Florida to as north as Wisconsin, all the way down to Texas. And North Pinellas has the privilege of being one of those hospitals. And we have been under the AdventHealth umbrella for about 15 years now.
Okay.
And it has been a really great experience for our community as we've been able to invest in high quality health care. And so AdventHealth North Pinellas has been around for about 100 years. 100 years. We're going into now we're in 2026. I have to say that now because we just the calendar year changed.
Right.
So we're in our 99th year now.
Wow.
And so that's been very exciting to be partners here. And then about almost 10 years ago, we had the OSED here being launched. And it's been a great privilege to extend a little bit more south here in
Right.
Pinellas County. We have a variety of different services, from urology to heart and vascular care to digestive health care. But one of our premier services that we provide, and Dr. Barquin and team do an exceptional job, is our emergency services care. And we've received a number of different awards and accolades as such.
Awesome. Well,
Yes, I guess we could say that we're very proud of the awards that we received here that put us in the top 5th percentile last I saw on what you showed me last month. In patient satisfaction, more and more we recognize in the world of healthcare that the whole care experience for the patient is usually at the forefront and should be at the forefront in the conversation. And I think that the mission and the principles that Advent brings forth to their culture really helps patients, really helps them appreciate the care that they receive in the emergency department, because it's a very different approach that we take, I think, compared to your traditional healthcare system.
okay.
I'd love to add a little bit to that. So Dr. Barquin is alluding to an award that we received last year. And I always have to pause before I say the award because it sounds like it's the Guardians of the Galaxy Award, but it's actually the Guardians of the Excellence Award.
Okay.
And various departments, hospitals receive it. You have to be in the top 95th percentile. And
qualify.
something called Patient Experience, which is a survey that consumers or patients receive after a hospital interaction,
Okay.
whether that be in the ED, whether that be in our inpatient units, and they judge you to rank you across the board. And remember, school 95th, that's pretty good, but the ER team here last year, we just concluded, they were in the 99th percentile.
Wow.
So they really, truly do an exceptional job on delivering that whole person care that we
Good
strive
for you
to
guys.
deliver.
Good for you guys.
I think if any of your listeners have ever been here, we're so fortunate to see our patients, when they need us the most, come back and visit us, and a lot of their sentiments reflect that. Just an excellent experience here from the time they walk in the door to the time that we've got them discharged. Overall, a great experience.
I would say it makes my job so much easier too to have a team like this, because as the chief medical officer, my primary responsibility is quality of care and patient safety. And when a patient comes through our front door, which is the emergency department, whether it's here in Palm Harbor in the main ER, in the main hospital, and that experience is world-class, it sets them up for the remainder of their care to be world-class as well. And so I hear accolades all the time, and our tendency is to focus on the misses or the mistakes or the difficult situations. But as those are fewer and fewer, it's just really amazing how many times now we're hearing all the positive experiences, and it all starts at the front door. So kudos to the team for that work.
Yeah.
And those experiences, they speak volumes for you guys being involved, with the people and the families of the Palm Harbor community and the whole North Pinellas community. So that's huge, because trusting a place to give you care, or your kids' care, or your parents' care, senior care, is it's hard. It's hard to do, and
Well,
we thank you for what you guys do.
We appreciate that, and I will jump right off of that. I've had all of my family members receive care at these ERs and the main hospital, including my children. So yes, the trust, and I don't live in Palm Harbor, but
Yeah.
yes, the trust is there for sure.
Well, I have a personal experience because my wife had to come in here, and it was a tough situation. But mentally,
Yeah.
she was very emotional, and I said, just go in there, they'll take care of you. And when she came home, she goes, oh my gosh, it was an easy process. Those people were great, easy to work with, love the customer service. And that's from the very start of it, of being that stressful and that emotional, versus the calmness afterwards.
That you came
It
home
speaks,
with.
yeah. It speaks volumes.
Yeah.
It does speak volumes.
I actually just received a patient letter from an experience that was here in this ED, and Dr. Barquin can add to that. But a gentleman came in, and he recently lost his spouse of almost 40 years. And this was going to be his first Thanksgiving without his wife. And he came here, was not feeling well. The team did an exceptional job on getting him fixed up and getting him back home in time for Thanksgiving. But it was the interaction there that they found out that this was going to be his first. And they just didn't want him to spend it alone, because they asked him what he was doing. And he said, I'm just hanging out at home by myself watching football. So the team here actually said, that's unacceptable. We want to make sure that we are able to help you have a good experience, not only inside here, but outside his home. They came on Thanksgiving and made food for him, gave him his tailored snacks so he could be able to watch the football, checked in on him to make sure that he was doing well. And that's the kind of care that the team is. I mean, that wasn't paid for. They did that on their own time, on their own watch. They want to make sure that a community member here in Palm Harbor was not going to spend Thanksgiving alone. I mean, that is
That's a good story.
truly
I like that.
absolutely amazing. That we went above and beyond to make sure that he had a good experience.
Very cool, very cool. Let's switch gears a little bit. In regards to this location, let's kind of focus on what's happening in between these walls. Because a lot of our audience is like, well, I understand their emergency room, but what are the other services that are available here. If I need to come here, where do I go to? If I'm going to come to this location, what can I do here?
Yeah.
What services are available?
Yeah, so this is a fully operational freestanding emergency department. So we have to make sure that we provide the minimum services to be prepared in all emergencies. That includes receiving an ambulance that has a patient having a heart attack, a stroke, a bad accident on US 19. Right, we're sitting here in our trauma room where we've received those patients in the past, and so we have all the necessary services here to perform that task up to the standard of care here in this country, and that includes X-ray imaging, CT imaging, ultrasonography, and a full lab operating, giving us all the important blood levels to check for those heart attacks, to check for sepsis. And then there's always a trained and fully board certified emergency medicine physician on staff here at all times.
Okay.
So it's as if you were walking into a hospital emergency department. It's just we don't have that big building attached to us. And if you do need to be admitted to the hospital and you need to allow some of our other specialists to work on you, then we arrange that transportation and get you over to the appropriate space in our hospital to get the treatment you need.
Okay, that's cool. Awesome. That's really cool. There's just so many things in a hospital. A lot of people, I think, get intimidated by hospitals. You know, like, oh my gosh, who am I going to talk to? Are they going to diagnose me correctly? So, is there anything you kind of can hit on that? Because me personally, when I walk in, for whatever reason, I have to walk into a hospital. You feel a little bit uncomfortable because you're not sure who you're going to talk to, what information you're going to get, what's wrong with you, what happened, maybe it's an accident. So
I like to tell our patients that our job in the emergency department is to rule out all the emergencies, right? All the tools and services we have here are to make sure you're going to walk out of this place healthy, reassured, have your soul have your soul reassured, right? That we have looked you over and deemed you okay for discharge. And of course, if that's not the case, then get you to the hospital where we can better care for you, beyond the emergency department. So I think it's the most important thing, I think, for anyone coming into an emergency department is knowing that we're gonna make sure to do that, and we're gonna talk you through your anxieties, your concerns, and help you navigate the system. I mean, we don't hit that 99th percentile patient satisfaction and experience without making sure that every patient feels as if they were cared for appropriately and healed, right? I think I like using the word heal more than treat when I interact with my patients, because my goal truly is to provide that level of reassurance and make sure people truly understand what it is they may be feeling. And these days we all Google and Chat GPT things, right? So they come in thinking the worst.
Don't always believe that.
Always believe it. No, Google is Dr. Google all the way.
Yeah.
But that's our goal, is to kind of help you navigate that.
Yeah.
So you have a problem, we're here to help you.
Yeah.
We sure feel it when you walk from the waiting room to the emergency center back here.
Yeah.
You would never be able to tell you're not in a big hospital. I mean, you feel like, hey, this is, a legit space for me to get some help if I need it. So it's nice to see that. It's not a makeshift emergency experience or emergency center experience. This is a legit.
So we're in.
So,
Absolutely.
yeah.
Yeah, and I think Dr. Barquin said it well. I mean, from emergency care in terms of that, it's soup to nuts in this facility. I think where a lot of the anxiety comes in is, well, if we don't have an answer right away, or we need to do some more testing or observation or medications, and the patient does have to stay, there's a natural anxiety around that, and we run into that when, several times a day we need to admit patients to the hospital for further testing and care. And they're not always prepared for that, but what I would add is it's maybe a mini PSA here for a second, but it goes really for anyone in any city or state or any department. If you're gonna go to an emergency department and you have an opportunity to bring a trusted friend or family member, someone with you, a neighbor, someone that can hear the same things you're hearing, because there's a lot of information that comes at you.
Yeah, I agree.
And we're not, even, you know, when I wear my patient hat and I'm with a family member, there's a lot of information because I'm focused on them, not really on being the physician in that circumstance. And so we know the language, so for us, it's fast, it's
Yes,
quick, we
yeah.
know what's happening, hey, don't worry about it, but the patients often need a lot more information, and they just can't remember it all when they're already nervous and expecting certain things. So bringing someone with you to take notes, ask questions, sort of rehash what they heard as well is ultra helpful.
Or put them on speakerphone.
Yeah, well, we do that too.
That's what
we
happened to
do
me,
that
'cause
too.
Yeah.
Yeah,
My
It
wife was
helps
like, "Oh my
me.
gosh, they're throwing so much information at me."
yeah,
Yeah.
yeah.
I mean, I know it's their lingo, it's not mine,
Yeah.
and I don't understand it. So she's like, "Hey, Doc, could you start over again?" And so I listened in, so we can kind of get that confirmation. So I'm glad you brought that up.
Well,
I
it
think it's
helps-
very
That
important.
is very
It helps
practical
with the
advice.
patient's comfortability level when they're here, which is, I know what you guys want to accomplish too, because if someone's panicked or
In pain.
anxiety or in pain,
Yeah.
it's hard to get them. I mean, having somebody accompany you could make, you know, a huge difference in not only your experience, but able to remember or understand what a doctor's, you know, talking to you about and
Yeah.
what needs to happen next. So.
And Matt, one of the things that you said, and you're absolutely right, in AdventHealth, we've identified that is when you're able to involve more people in the care to be able to help when someone leaves the hospital, we want to make sure that communication is very smooth. And so one of the things that we're doing from an innovation standpoint is that we're installing something called smart rooms. And this is a technology across all of our hospitals that we are going to be installing this in all of our patient rooms. It's going to be a large monitor that you can basically almost think about FaceTiming or calling in, okay, my spouse isn't here, or my caregiver, my aunt or uncle is not able to be here. I'm going to call them in. I'm going to have the physician right here, so they're able to walk through like a discharge plan on everything that is needed so that the care is seamless. And these smart room technologies are going to be able to help many different facets, but it's another piece that we're trying to be on an innovative cusp, so that we can be able to make sure that we're providing that care. Because really, healthcare is complex. Like, it's not easy to navigate. I get calls almost every other week about, hey, can you help my loved one to navigate them to go to this physician or that? And we want to be able to be very focused on what is the end user's experience that we have, and how do we make that as easy as possible for
When
them.
you're investing in the future extended care after they're gone, because you're not only educating them, but others, family members, friends, or whatever,
Yeah.
with them. So, yeah.
I can tell you, actually, that's we just installed that a few months ago as part of that initiative, right?
Okay.
So, as an ER physician, if a patient is having a stroke and it is a complex circumstance that I want some more support with, I can buzz the stroke neurologist on call. They can get on camera within moments, literally within 2 or 3 minutes, to help make those very time-sensitive decisions with me and with the patient and their family. So it's AdventHealth is really positioning themselves to be on the technological cusp of healthcare. Another great new addition recently has been the integration with something called Epic MyChart. So the moment you check in, you sign up on your phone, you'll get a text message, and then with that, as the results come back, as the physicians and nurses get the imaging results and the lab results, the patient is also being notified that those results are back.
So you're communicating through the whole process.
The whole process, if there's a slight delay in X, Y, or Z, you're getting a message. If you want a blanket and you can't reach the nurse button, you can request one on the phone, on the smart app. So really taking it to the next level to differentiate ourselves from some of the other local hospitals.
Very, very organized. That's
Yeah.
why I'm looking over here. I know the camera can't see it, but I'm looking at this going, wow. I know it's not called a toolbox, but it's just really very meticulous on what is in those little toolboxes, if you will. It's like, wow, very, very organized. And I saw that when I was walking in. I'm like, wow,
You want to know where
really
everything
good.
is when
Yeah,
time matters.
that's true. That's very true.
So it
That's
is.
very true.
Everything is very nicely labeled. We
Good.
practice and review all that equipment. Yeah.
Awesome. Let's switch gears here. How you guys got involved with the Palm Harbor Chamber? The why and the what?
Yeah.
So,
You know, when we look at Pinellas County, Palm Harbor area is growing. And we want to make sure from an access point, that's one of our goals, is how do we provide high quality access. There's something called a community health plan that is the whole county reviews. And we're working with multiple healthcare systems on how we improve and coordinate care across the board, not only AdventHealth but others. And we look at that, and when we see from a mental health standpoint, and then we see from a quality of food standpoints the others, how do we show up in our communities? And when we look at from Matt, what you're doing at the chamber here, when I look at what are your objectives and your goals and how do you be a leader in the forefront in the business, how are you making sure that people are able to be connected? How are you infusing growth with there? I mean, those are all of the areas that we also want to be able to show up and how do we participate in. And so what we're doing here is that we want to be able to be where people are growing because we want to be able to make sure that we're providing that care for those that are moving in there. I mean, when you're looking at a place to move, you look at various things. You look at how good is the school system. You also want access to high quality care as well, like Dr. Barquin said, when you need it most. And so that is what we're looking at. So we want to make sure that we're tying with how you're growing with the businesses. And we've been able to privilege to receive actually one of the awards this last year. And we want to be able to do more in the community. And so we're going to be looking at how do we extend and partner through more of some of the educational systems here. We have done various things from volunteering initiatives with how do we build beds for children that need it so they're not sleeping in an adequate bed or on the floor in some instances. And so we were able to do that here in Palm Harbor. And we want to be able to do more in the community. And so that is one of our goals, is how are we showing up more in our communities, and Palm Harbor being a big piece. There's no better way to be able to do and tie all that together, and it's through the chamber that is able to have access to all those businesses and the needs that they have, and how can we help doing that.
Well, from a chamber perspective, you as AdventHealth North Pinellas are, a necessary community partner for Palm Harbor community, because not only for the people, the families, citizens, but also businesses, and attracting businesses here. I mean, because of you guys, our community attracts better businesses, more businesses that are focused on the community too. And I think all of our goal is to make this community as strong as possible, whether it's the business community or the people that make this community. So we appreciate, that partnership and what you enhance in our community here in Palm Harbor. So thank you.
We just don't want to be known as a place that you go when you're sick, but a place that you go from a health standpoint, and that in a wellness standpoint. And that starts before someone walks through the ER doors here or comes into an ambulance here. That is, how are we infusing that from an educational, from a volunteer, understanding what are the needs and some of the business have. We've done various different screenings and partnered with, from the YMCA to various others, to what does a healthy community look like, and having access to what the chamber does in connecting businesses. We want to do more than that than we have in the past. And so I'm excited for that in 2026, is how are we showing up more in the Palm Harbor community when it comes to a health and wellness standpoint.
Yeah. Well,
wow, this is pretty cool.
yeah.
We should walk around here a little bit more, but I think people will probably be looking at us going, what are you doing here? Like when I walked in,
Bring
the guy
your
goes,
roller skates. You
Yeah.
can really
Yeah.
get a
Yeah.
head start.
well, when I walked in, the guy goes, he looked me up and down like there was something wrong with me. I said,
Doing the
part of
full
the
wellness
Palm
check.
Harbor Chamber podcast? He goes, right back there.
It is. You reminded me of something as well. I think we're probably a little bit flat-footed with hurricane season, having been a quiet hurricane season this time around. But this facility is one of the few facilities that were open throughout the entire storm. We're at one of the highest areas in North County as far as elevation goes,
yeah.
and this building is built and armored to withstand Hurricane 5 Category 5 hurricane winds, and so we will be here night and day for Palm Harbor through the worst, and those storms included. So I think that's oftentimes something I know I was very proud of, being able to be open here for that team. So while you're roller skating in a hurricane, you can do it here.
I don't have roller skates, but I probably won't invest in any roller skates. But
Well, it's a visit here for the ER.
skateboard maybe.
Pinellas Trail. There is now, especially after Christmas. Okay, another great PSA is wear your helmets. Stop at the stop signs at the trail, right? We see, we've been seeing more and more younger folks on these electric bikes. And, it is
It's a whole nother.
yeah, roller skates are a thing of the past.
That's a whole different podcast.
That's a whole
Don't start
different
that.
one.
Don't
Yeah,
open up that can
yeah.
of worms.
Well,
Pickleball injuries,
Right,
too.
yeah.
I say this
Really?
because he's a little bit of a pickleball
Forehand or backhand?
amateur here.
Forehand.
We're still owed the match.
Yeah,
And
that's
we're
right.
gonna meet you on the court there. Seen a lot of those. So it's interesting as the cultural trends evolve from e-bikes to pickleball. We see our evolution here of ER injuries.
yeah, I'm sure.
Yeah.
Yeah.
Well, we really thank you guys for taking the time
Yeah.
to be a part of this, and we appreciate all that you do for this community.
Yeah.
And
I
thank
appreciate it. Thank you guys.
It's our
I appreciate
privilege.
it.
It's our
It is.
privilege.
And for our audience, just a little taste, because before we came on air, we talked a little bit more about the health side of things. So stay tuned, because we're going to be hitting that health side of things. It's going to be a very interesting podcast. So
Looking forward to it.
yeah, thanks everyone. I appreciate you guys. Thank you.
Thank you.
Don't forget to subscribe to the Palm Harbor Chamber newsletter for updates and the next episode. A big thank you to our trustees for their incredible support. This podcast was produced by ABS Photo and Video.